Hi, I'm Brent, Lyles. I work at Boca Recovery Center. I'm a primary therapist here. I've been here for about 2 years working with the clinical team. My passions and my training is in dialectical behavioral therapy, trauma-informed therapy, as well as geek therapy. Trauma-informed therapy is an approach that we as clinicians take where we meet the clients where they're at. When we think about this, we break it down into different modules. One being safety, which is how you show up to session and how I show up to session. By doing that, we're able to create a safe space where you feel seen, heard, and understood, and being able to be comfortable with sharing your lived experiences. Another module of Trauma Informed is the ability to form a trusting and transparent relationship with me as the clinician, where we are no different than each other, and I meet you where you're at and make sure that you are having choices in your treatment to better you, which gets into more of another module of this empowerment. Empowerment is very important for someone who has lived experiences of trauma to be able to voice choices and to be able to have a voice for the first time ever. Collaboration is another module where we work together and we see what works and what doesn't work. I don't always have the answers. You are the guide of your own life, and I'm here to assist. And the last one we think about in the last module is something that's called transgenerational trauma, which basically means that we're gonna look at your history, your family history, your cultural history, your sexual orientation, everything, and see how that has shaped and impacted you. So some of the techniques that I use from a trauma-informed perspective and approach, one is narrative exposure therapy, which is evidence-based. What we try to do is reframe the story and allow you as a client to be the author of the story. Another technique and approach that comes up is something called somatic experiencing, which basically means how do I allow you to work through a lot of your stored trauma that you hold in your body, right? We always think of it that it's only in the mind and the memory. That's one component. The second component is trauma lives within the body itself. So with this approach, I allow you to release it from the stomach area that's affected, your chest area or your voice. And it allows you to kind of release that tension, that negative energy from your body that you don't deserve to have. Another technique that I use a lot is something called dialectical behavioral therapy. It's broken into 4 different modules: mindfulness, emotional regulation, distress tolerance, interpersonal effectiveness. All of these work intertwine with each other. The last one that is not empirically based is Geek Therapy, where I actually blend in pop culture. I use films like Star Wars, Lord of the Rings, your superheroes, anything you can think of that allows you to feel connected and feel back and live in love with your inner child. Because a lot of us are hurt, and our kids are hurt inside of us. And it's all about reconnecting to self again. I think anybody can benefit. You don't have to have trauma to be able to not be impacted by a trauma-informed perspective or approach. And what I mean by that is the therapist is solely thinking about you and strengthening you to the best version of yourself. And not only that, but showing empathy and truly understanding your lived experiences and believing them and being able to process that pain and understanding that there's an acceptance component with it and that you can move forward with it and you can become empowered by it.